Hey guys, welcome to Alive at 5 here at Valencia Medical Center. We are going to be talking as usual. We're going to be focusing a little bit more on regenerative medicine today, but I know we have a bunch of different questions that we've got from you guys over the last week, so we're going to be taking it as well as any questions that come to us live during this the next 15 minutes or so. So thank you guys again for joining us. We're talking today about regenerative medicine, which is part of the stuff that we do here at Valencia Medical Center. We became very known here for our PRP injections in the area, which is something that we really like doing and we're very proud of. And with the PRP stands for platelet-rich plasma, so I know we're going to be talking a little bit more about that today. So if you guys have any questions about that or anything in general, let us know.
So what is platelet-rich plasma or PRP therapy?
And that is Cassie behind the...
I'm here.
on the other side of the camera, and she's reading some of the questions. So what is PRP was the first question, and PRP stands for platelet-rich plasma. It's basically a product that we get from your blood. So when we, we start by taking out your blood, and we use, over here we particularly often use the Apex system, which is a leader in the kind of just whole area of PRP nationwide. And so what we do is we take your blood and then we concentrate the platelet-rich plasma. And the reason we do that is that because that portion that we get out of your blood, where we have a lot of platelets, it's a very effective product that we get out of your own blood that can be used for many different procedures that can be done, mainly things like joint injections. And the reason we do that is because that platelet-rich plasma is rich in platelet, as the name suggests, and the platelets are cells in your body that are rich in growth factors and cytokines are ways that cells communicate to each other. So basically what happens is that platelet-rich plasma is a very rich serum that we can inject in areas where there's like knee pain, for example, or joint pain or shoulder pain, among other stuff, and it can have a very powerful healing properties on that joint, again, depending on what exactly is going on. PRP also has a lot of uses in the aesthetics field, so we use it. Many people have sometimes called the blood facials or the red facial, or among many other names. But it's used because, again, these cytokines, these growth factors, these healing factors are very powerful. And obviously people are always trying to get creams and stuff with growth factors and healing factors, but obviously when you can get it from your own blood, these are made for you, and obviously we're doing it in a much more powerful procedure, so that's why it can be very very beneficial.
So do I have to worry about the use of these blood products? I guess maybe just talk about if there's, I don't know.
Yeah, so in terms of worrying about using these blood products, most patients, are going to be able to use, their own PRP very safely. It is your own blood, so, you're not gonna, it's a lot less likely to get any side effects than when you're using an external product, for example. So we're taking your own blood and then we're putting it back in you. We're putting, certain cells of it, certain portion of it. So we're not adding anything external. We're just concentrating the beneficial, things, the beneficial platelets together, and then putting that concentrated form back whenever we need it, just to kind of kickstart that healing process. So, it's your own blood, so you're very, you're not gonna react negatively to it in that regard, as you might react to something that's synthetic or that's kind of external. Not that synthetic stuff don't have good uses, but in that regard, PRP is much safer, much less likely to cause issues or damages for most people.
Awesome. So I guess maybe talk about how do we know if people are a good candidate? How long is the recovery? How long does the actual procedure take, I guess? You wanted to touch a bit on that.
Yeah, the actual procedure will obviously depend on what procedure we're doing. Usually the process of taking the blood and getting the platelet-rich plasma out might take somewhere between 30 to 45 minutes, again, depending on exactly how we're processing it and what we're trying to get. And then if we're doing a joint injection, that's usually much quicker than doing like a hair injections, because we do use platelet-rich plasma for hair injections. We also use it as we've mentioned for aesthetics. So it really does vary depending on the procedure, but it is, for the most part, these are, takes about 30 to 45 minutes to prep the blood, and then we're talking about anywhere between 10 minutes to 35 or 45 minutes for the procedure itself, depending on what we're doing. So you're talking somewhere between 45 minutes to like an hour and a half, maximum 2 hours altogether. Most of the procedures that involve PRP don't really don't cause any downtime. So if you're doing the face, there might be some redness, some minor bruising for a couple days, but they don't tend to have any serious downtime. Who's a good candidate? For joint injections, people with joint pain, depending on the cause. If people, with wear and tear, a lot of times we start getting, our joints are very complex and they involve so many different, structures of our body, so many different tissues. So when you have like your knee joint, for example, and that stuff can be applied for other joints as well, but you have your bones, you have your ligaments, you have the tendons that are connecting that joint, they're all within a joint capsule, and you have these meniscus. So all these stuff are delicate structure, and if you don't take care of them over time, which, once we're living our lives, we're not always, thinking of how, when we sit down or when we carry stuff or when we're growing up, we're not always, thinking about our joints as we do stuff that might be harming our joint over the long time. So with that wear and tear, it can cause some of these ligaments, some of these meniscus, some to get micro tears, to kind of weaken, to not be as healthy as they can be. And that's where PRP comes in, because with the PRP we're trying to basically get to the source of the problem. Once you have the weakening of the ligaments, these tears in the ligaments, they might be causing pain. Your body might respond with weakness in that joint, maybe instability when you're walking. You might you might be walking with a limp or just have pain, or maybe you're fine, but now you go for a walk or you go for a hike or you do anything which you should be able to do without any pain, but it's causing you significant pain, it's causing you discomfort. And as opposed to just sometimes taking a medication to cover the pain, like Tylenol or ibuprofen, which might help for an hour or two or might not help. If you can get to the source of the pain by kind of getting to give these weakened ligaments and these weakened tendons and the damaged meniscus, if you can give them the healing factors and the platelet-rich plasma, and the idea to help them kind of restore their health as much as possible, that would be a more kind of ideal solution. And that's why PRP is becoming more and more popular, because people are looking more and more. People want to be more active, obviously. No one likes to be limited by pain. So people are trying it and they're seeing a lot of benefits, and so and people are coming sooner, because there is more awareness right now. A lot of people are actually coming at kind of more beginning stages of their pain, which is great, because obviously the more damage that's done, the harder you have to work to repair it. So if you can come in as soon as you start, noticing any damage or noticing any issues, and you can get started with, kind of attacking the problem before it becomes a huge problem, then obviously you see more benefits. So that's another thing that we're starting to see. We're starting to see people who are coming in, earlier and earlier, and considering PRP sooner and sooner, which in my opinion is a great thing, to be honest.
So somebody's asking, how does PRP help with hair growth? So it would just sort of be along the same lines of just restoring the hair.
Sure, yeah, and it is, and that's why we love PRP, because, and it might be surprising to some people that you can use it for so many things, that it can be used for joint injections, for aesthetics, for hair. But once you think about it, your body has different types of cells. It has the red blood cells, which delivers oxygen to all cells in your body. You have white blood cells, which prevent infections, and it fights all kinds of infections. And then the third type of cells in your body, or in your bloodstream, I should say, is platelets. And platelets have growth factors and cytokines that can be helpful. They're not specific. It's not like you only have platelets in your joint. Your body's circulating blood, and it's circulating the platelets throughout your whole body, because there can be so many different problems in your body that the platelets can help with. Just like all different cells in your body will need the red blood cells, they'll need the white blood cells. They can also use the platelets when there's an issue that needs that needs the growth factor that the platelets has, that needs the cytokines that the platelets have. So in that regard, once we concentrate the platelet-rich plasma for the hair, for example, we do it in a way, and then we inject it in a way where the hair roots, where the hair follicles, are, where the hair root is, and by feeding the hair, the root of the hair, by feeding it these growth factors, these cytokines, or creating a whole field that's rich in these cytokines and these growth factors, it just helps. It helps nourish that hair, and it's gonna help strengthen it. So people who are noticing that their hair is thinning, they're starting to lose hair, a lot of times they come in for PRP treatments to help combat that.
Awesome. So you would say that this is PRP sort of the secret, is everybody sleeping on the PRP treatments, that they should be coming in and doing these types as preventative medicine? Because I know that you did touch on the PRP, joints. So is this something that, how do we know, will this work for everybody? How does that whole process sort of go down?
Yeah, and just like everything else, there's not one thing that will work for everybody, and for everything. But it is definitely one of the treatments that works for so many people that honestly it's just a great treatment and option to have. Now, sometimes you do turn people down because they're not great candidates for a PRP, and sometimes people need surgery, for example, with the joints, So, it's not right for everybody, but anybody with joint pain should consider it and look into it to see if they are a good candidate, because it is something that's finally starting to gain more and more attention, but it hasn't been, and that's a great thing, but for so long it hasn't had the attention that I think it deserved. So a lot of people aren't aware of it, and so they just think that their options are only surgery, ibuprofen or surgery, kind of thing, and then they don't realize that there are other options in the middle, and there are tons of options, when it comes to joint pain. A lot of times, again, depending on what's causing it. So it is great to have PRP. So it's not for it's not for everybody. If you have completely torn ligament due to an accident, you might need surgery. You can't just come to PRP and think that you won't need anything. And it's not a magic bullet either, if as we were talking, the earlier you catch it, the better it is. But if someone's been having, so much pain and for so long, or the damage has been building for so long, maybe they're not gonna do one PRP and then all their problems are gonna be solved. We're not trying to promise that. But maybe they will get, 40% better, and then maybe 6 months later they'll do another PRP. Or maybe they want to do bone marrow stem cells because it's a little bit more aggressive, So it is something that anyone with joint issues should consider, and at least talk to their provider about it, and or they can call us, and then we can see if it's good for them or not.
Awesome. So I think somebody was asking, is there recovery? How does the recovery work? Is there downtime?
Yeah.
And
we'll just use the knee pain as an example here. Most people, when we do their joint injections, the procedure itself is not painful at all, really. I mean, we do apply a little bit of numbing, and then we inject a little bit of lidocaine where we're gonna go in with the PRP. So it's not a painful procedure, but we do tell them that we're starting that healing process. We're the PRP are calling cells to the area. They're causing a little bit of inflammation. A lot of times when we think of inflammation, we think of it as bad things, but inflammation in the right, setting can be, a good thing. Inflammation is your body's respond, to an injury. So if in the long term, if someone has, prolonged inflammation, that's a bad thing, but, inflammation in the right setting is a good thing. And I mean, that's a different topic. So kind of going back to your thing, there is going to be a little bit of inflammation in the knee. So some patients, honestly, they do the injection and, that same day they're back, they can come in during the lunch break, do the injection, then go back to work, and as if they haven't had anything as they wait on the PRP to kind of take effect, because it can take, sometimes after you do the injection to see the benefits. But sometimes people might get a little bit of swelling or a little bit of more discomfort in the knee for for a couple days, and then it gets better. It's not something that's gonna, make you bed bound where you can't stand, or it's gonna stop you from walking, in your home or anything. It just, a lot of times people, I'd like to say, people come in with, let's say knee pain, and they have good days and bad days. It might be for a couple days more of a bad day, so kind of what you're used to on a bad day, so it might be like that for a day or two or maybe 3 days, and then it kind of goes back to normal. But nothing, you can still go and do everything as usual for the most part.
Awesome. So I don't know if you wanted to just maybe add a little bit more. I think that's sort of all of the questions that I feel like you sort of touched a lot on what it is,
I mean, again, I'm sure there's things might come up that we didn't touch on this time, for some of our viewers. So obviously send us a message or give us a call if you or someone, a loved one does suffer from these, from joint pain, whether it's knee or shoulder or ankle or elbow or other joints. You can always call us and we can do something that's more, personal to you, because these are very helpful, but obviously we have to stay, kind of more general in these conversations, because, we want to try to make them apply to everybody, but the issue is we can't get super specific. But no, honestly, it's just something, again, might not be the magic bullet for everybody, but it is something that, anybody should be able to at least know about and consider if they're suffering from joint pain, and just know that it's an option, and then you can figure out if it's the right option for you, if there's anything else in the option. But it is, and the reason I say that is because a lot of times people will come in and they're like, I didn't know that was an option. Like, they'll come in and they're like, I wish I knew that, let's say they're coming in for the left knee, and they're like, I wish I knew that before I did my right knee. I had to do whatever, I had to do surgery for my right knee. Or they come in for the shoulder and they're like, I wish I knew. And sometimes people come in and again, we're like, you're not a good candidate, you have to go another route. But just know that there is an option. Read a little bit more about it, do your own research, and if you have any questions, just come back to us. Anyways, thank you guys for joining us, and we'll see you next week. Have a good one.
Thank you.